Thank you for staying with us. In part one of our special report on male infertility, we learned what this condition is and who it can affect. In the second part, produced by Reagan Des Vignes, will show you the simple method which allows you to test your sperm.
The test is quick and painless. In fact, for some, it may actually be fun.
You go about an ejaculation with the use of visual aids. We have some magazines here that you can use to assist you.
But the fact that 1 in 10 men in TNT is faced with infertility issues is no fun affair.
That definitely tells us, Reagan, that there is something that needs to be looked at when it comes to male reproductive health in Trinidad and Tobago.
1 in 10. A number higher than found in developed countries across the globe.
To point to a single factor which would be causing male reproductive health issues in Trinidad and Tobago would be quite a bit difficult. There are a whole host of things, and one of the things that we were going to do as an extension of that research project was to look at environmental causes and genetic causes and to see if we can pinpoint a specific set of reasons why male reproductive health issues are generally higher in Trinidad and Tobago as compared to more developed countries. Also, that study did point out that about 34% of the populations of men presenting to our clinic had something which is called severe oligospermia, and that just means that the concentration of sperm is extremely low. 34% is indeed a high number.
The causes are inconclusive, but according to IVF and Fertility Center Medical Director Dr. Minto Bain, male infertility in TNT is cause for serious concern.
If you were to theorize, in developing countries there are worse environmental pollution problems. We've been exposed to those since we were born here. Our mother was exposed to a range of things when she was pregnant with us. We know our diet's not good, and we know we have high rates of diabetes, obesity, maybe there are genetic issues here. So there are a whole range of things that it could be.
How can I develop or maintain a healthy sperm count or healthy sperm?
It's actually the same general advice that you would be given in terms of having a healthy body. So if you want low heart disease, a good long lifespan, a low risk of cancer and good fertility, you should eat well. Good healthy foods, we all know what those are. Less of the junk food, more of the fruits, vegetables, water, all the healthy things. Take a multivitamin if you want, but actually you can get what you need from a good diet. Exercise, keep a good healthy weight, try and sleep well, try and avoid stress, enjoy life and stay away from the bad drugs and the bad things that you shouldn't take. And actually that's the best advice.
Sperm is important, obviously, for conception. It's the other half of the equation. And here at the IVF and Fertility Clinic, first and initial tests check the concentration of your sperm, the shape of your sperm, and the motility or the movement of your sperm.
The first step in a semen analysis is that we'll escort you to what we call a collection room, and in that collection room there are visual aids which will help you with ejaculation.
No, very structured. All right, great, thanks. Good luck. Get out.
Generally, there's a bathroom nearby where you can go and wash your hands before collection, and then there's some instructions as to how to collect in terms of filling out the appropriate forms, etc. Because one of the things that we must stress that is important at Trinidad IVF is the fact that each sample that we collect must be adequately labeled. And when we talk about labeling, we focus on your name and your date of birth for a semen analysis. And so once you get those menial things out of the way, then you proceed to collect.
It's a simple test that can shed some light in the viability of your sperm cells.
Whoa, are you serious? Look at them go!
And it comes highly recommended once there are problems if you are trying to conceive. For C News, this is Reagan Des Vignes.